Hi, I'm Ted Venema. Let's talk about sudden sensorineural hearing loss, also known as sudden idiopathic deafness. And the word idiopathic is listed in there because, like idiots, we don't know the cause of it. We don't have a good handle on that. Usually, sudden idiopathic deafness hits one ear, not both. And it's to be treated not as a nuisance. One should see a physician right away. Many people think, okay, it's just a blockage of wax, or it could just be an ear infection, and they let it go for a couple of days, and then they see the doctor, the general family practitioner, and already now it's too late, who makes them wait another how long, days, weeks, before they can get in to see an ear, nose, and throat doctor, and by then the damage is irreversible. What an ENT will do is likely prescribe corticosteroids that you'd take orally, and the sooner this is done, the better are the chances that the hearing loss will reverse to the greatest degree. People notice sudden idiopathic deafness in different ways. Some people notice it when they wake up in the morning. They just can't hear out of one ear. Some people kind of hear a pop and then the deafness hits. Some people have it accompanied by a bout of dizziness or tinnitus, ringing in that ear. Either way, if one notices a dramatic hearing loss in one ear, overnight or in a short period of time, it's not to be treated lightly. The quicker the treatment, the better off the chances are, or the better are the chances of being able to do something about it, and the treatment is usually corticosteroids. What's the prevalence? How common is sudden idiopathic deafness? Well, it's about 5 to 20 in 100,000 people. The range is a bit hard to define because some people, it reverses itself to some degree. It's hard to get a firm handle on it, but about 5 to 20 in about 100,000 people. This is to be contrasted to an eighth nerve tumor. Eighth nerve tumors also cause unilateral or one-ear, one-sided deafness. And the incidence, or I should say the prevalence of eighth nerve tumors is about 1 in 100,000 people. Meniere's disease is about 200 in 100,000 people. So bilateral sensorineural loss, hearing loss in both ears due to cochlear hair cell death or damage, is very, very common. Presbycusis is the biggest one of those. Noise-induced hearing loss can be more in one ear than in another ear. Hunters, rifles, the side of the noise that got the most damage or whatever. But unilateral sensorineural loss is generally not to be taken lightly. One wants to rule out an eighth nerve tumor, but other causes of unilateral sensorineural loss could be Meniere's disease, and as we said, maybe noise-induced hearing loss being more pronounced, like a trucker having it worse in his left ear because of the window being open, or a right-handed dentist being closest to the drill. I mean, these are more common causes of unilateral hearing loss, but when one loses almost all hearing, or a lot of hearing, in one ear, that's a sudden sign to see the doctor soon. Because less common causes of unilateral loss are vascular, metabolic type of autoimmune deficiencies, and these are more likely the causes of sudden idiopathic deafness. The point is, we just don't have a good handle on it, hence the name. Audiological criteria for sudden sensorineural loss. Here's an audiogram. This is showing you frequencies across the top, looking at decibels going this way, and normal hearing would be perfectly around 0, meaning it takes no more than 0 decibels to just barely hear the tone with either ear. Normal hearing cutoff is about 25 decibels. Well, sudden idiopathic deafness means you've got to have at least a 30 dB hearing loss for 3 adjacent frequencies. That's the minimal criteria for sudden idiopathic deafness, but it usually is much more pronounced than that. I knew of someone who had excellent hearing at 125 and almost nothing thereafter. And she just got it one morning, she could hear the dial tone on the phone, but that was about it. and it happened overnight. Again, the treatment is corticosteroids, and many good ear, nose, and throat physicians say this: if you have a client with, or you know someone with whom this is suspected, you don't always have to go through a general practitioner. Good ear, nose, and throat doctors will take a referral straight from a non-physician practitioner, such as an audiologist or a hearing instrument specialist or hearing instrument practitioner. And if one suspects sudden idiopathic deafness, a good ENT will see this person quite immediately. I'll finish with some treatment is actually a transtympanic approach of delivering the corticosteroids straight to the cochlea, but as to see if it works better than an oral ingestion of corticosteroids. But the research is inconclusive on that. At any rate, there's making a rather difficult topic, not really well known, maybe slightly better known. At any rate, thanks for listening. See you next time.